Hi, I'd like to introduce you to athletic training at Mount Holyoke College. My name is Perrella. I'm the head athletic trainer, and I have two very competent and certified assistants. We also have a staff of athletic training aides, Mount Holyoke students who are certified EMTs that help with practice and game coverage. We also utilize student athletic training interns from Springfield College and Westfield State. A few comments about understanding working with an athletic trainer. We are a team of sports medicine professionals qualified and proficient in injury and illness, prevention, examination and diagnosis, treatment and rehabilitation of neuromusculoskeletal conditions and other health concerns that you may have. We will work with you through the continuum of care, from assisting you with an on-the-field injury, assessing an overuse injury in the athletic training room, and striving for performance enhancement. We are not trainers, we are athletic trainers. We don't want to be confused with other personal trainers and other kinds of trainers. Communication is key. When you communicate with coaches and your athletic training staff regarding any pain you have beyond soreness related to training. Do not self-diagnose and treat your injuries. Let us use our knowledge base to help you through any injuries incurred. Let us help you stay in action or get back as soon as possible. Make sure you understand what is the process, any treatment, any restrictions, etc., and ask any questions if you need clarification. Once care is established and we have done an evaluation and commenced treatment and prescribed a rehab program, please follow up with the athletic training staff, i.e., do not disappear. We will prioritize our time with athletes who demonstrate compliance. In other words, you need to be an active participant in your own healing process. Know that athletes are responsible to have available any appropriate medications for allergies, such as an EpiPen or asthma, or any other medical conditions that you may have. Some safety and health considerations. The number one thing for injury prevention that is crucial to staying healthy is reporting to tryouts and practices well conditioned. The number one reason people get hurt is the too much, too soon syndrome. You need to gradually increase the stress of training imposed on the body. Anytime you do a lot of something you're not used to doing, you're at risk of injury. So understand that your actions have a direct impact on your health, your performance, and your susceptibility to injury. Hydration is key to performance and preventing heat illness. Athletes should bring filled quart-sized water bottles to every practice. And know that monitoring your urine is one way to know your hydration status. Your urine should be high in volume, light in color, and low in odor. That means that you are well hydrated. I'd like to mention a few bullet points for nutrition. Food is fuel is the bottom line. So here we go. 1, eat breakfast. 2, every plate for every meal should have a complex starch-based carbohydrate, a source of quality protein, fruit and or vegetable, and a healthy fat. Fluids, as I mentioned before, are very important. Drinking plenty of water and fruit juices are acceptable as well. Eating complex carbohydrates for energy. The body's number one choice for fuel is complex carbs. It's also a major source of fiber, vitamins, and minerals. Examples are cereal, rice, pasta, potatoes, vegetables and fruit, bagels and bread, and so forth. Fats play an essential role in the diet. However, they do take a longer time to digest and should be limited just prior to exercise. Healthy fats such as avocado, salmon and tuna, olive oil, nuts, flaxseed are also very important in the diet, a very good source of omega-3s. Protein is a very important food group for repair of body tissue and often neglected in vegetarian weight-conscious athletes. So make sure that you have protein again at every meal. Another important concept for athletes is the recovery nutrition. We all have a metabolic window that your muscles are most receptive to replacing glycogen, its source of fuel, 15 to 45 minutes post-exercise. And this is a certain ratio of carbohydrate and protein. Some examples are orange juice and bananas, peanut butter on bagel or bread, cereal and milk, an energy bar, apple juice, and chocolate milk. This can be especially important during 2 days in tournament play. A word for contact sports: if an athlete does happen to go down and is not moving, do not try and get that athlete up. Let the athletic training staff take care of the athlete. Players who need corrective eyewear must wear contacts or polycarbonate sport goggles, not street glasses such as these. Jewelry is in accordance with your specific sport, but our staff does recommend that you do not wear any jewelry at practices or games, and chewing gum for practices and games is not recommended either. If you're bleeding, you need to come out of practice or the game immediately and seek medical attention. Concussions is a huge and a very important topic that I will discuss for a while. A definition: concussion or a mild traumatic brain injury is a complex pathophysiological process affecting the brain induced by traumatic biomechanical forces secondary to direct or indirect forces to the head. Disturbance of the brain function is related to a neurometabolic dysfunction rather than structural brain injury. This injury needs time and rest, both physical and mental, to heal properly. Resolution of the clinical and cognitive symptoms typically follows a sequential course. However, it is important to note that in a small percentage of cases, post-concussive symptoms may be quite prolonged. The long-term implications of concussions are still not well known, so every precaution must be taken both to prevent and properly treat concussions if they do occur. Long-term and permanent behavioral and cognitive function can occur with repeated concussions. Signs and symptoms. There are 4 categories of symptoms: physical, cognitive, emotional, and sleep. The common symptoms are, and in order, headache in 75% of concussions, but note that not all concussions necessarily have a headache. Difficulty concentrating, fatigue, drowsiness, dizziness, feeling foggy, feeling slowed down, and light sensitivity, problems with balance and memory, and so forth. Nausea and vomiting as well. It is important to note the following facts related to concussions. No direct contact is necessary. Helmets have limited capacity to protect the brain. They really protect more the skull more than the brain itself. The magnitude of impact is not necessarily related to the severity of the injury. Women, as well as younger athletes, have an increased incidence and prolonged recovery to concussion. Understand that MRIs and CT scans are often normal with a concussion. Cumulative and chronic effects of concussions are important to realize. There's a significant difference between each category: 0 concussions, 1 to 2 concussions, and 3 or more, in terms of delayed healing, headache, and quality of life. 3 or more concussions have a 3 times greater chance of depression and earlier onset Alzheimer's. Understand the second impact syndrome. When an athlete returns too early after a concussion, one that is not fully resolved, the brain is more vulnerable and susceptible, so that even a minor blow can cause major swelling with fatal or lifelong debilitating consequences. Recognize, remove, and refer. You need to recognize, be familiar with the signs and symptoms, and recognize that you may have a concussion. You need to remove yourself from activity immediately to be evaluated, and you need to report to the athletic training staff if you suspect that you have a concussion, or if a teammate has concussion. It is also important to notify the athletic training staff. We do baseline testing on all athletes on a high to moderate risk sport, such as soccer, field hockey, equestrian, basketball, volleyball, lacrosse, diving, pole vaulters, and high jumpers on the track team. We will do baseline testing for impact and sway. Impact is a research-based software tool utilized to evaluate recovery after concussion. Sway assesses balance and motion reaction. It is a function of cognition. And as of this fall, only new members of the specified teams will have to do 3 baseline tests for sway. Returning athletes will just do 1. A word as well on MRSA, which is methicillin-resistant staphylococcus aureus. It is a staph infection that is highly resistant to antibiotics that can wreak havoc within an athletic department. If left untreated, it can be life or limb threatening. It can be spread by person-to-person contact, shared towels, soaps, and razors, athletic equipment, shin guards, etc. The symptoms is basically a skin infection, so it'll look like a pimple or a boil or a pustule, red, swollen, and painful. There may be some pus, most often located in areas that have poor airflow, such as the groin, armpits, and between the buttocks. Prevention: washing your hands regularly, showering immediately after activity, no open wounds in the whirlpools, do not share towels, etc., and care for and cover any open skin lesions. Treatment: if you suspect that you have any kind of infection, you need to see the athletic training staff or report to the health center physician. A word as well on sickle cell trait. It is a lifelong condition where one has inherited one gene for sickle hemoglobin and one for normal hemoglobin. During intense exercise, the red blood cells containing the sickle hemoglobin can change shape and accumulate in the bloodstream and block normal blood flow. This can cause significant physical distress and can result in death. Primarily the complaint is extreme weakness. The legs will feel like jello. The NCAA and Mount Holyoke requires sickle cell trait status is known. Understand that heat, dehydration, altitude, and asthma can increase the risk and worsen the complications. Recovery is always an important component and one the athletes are very interested in, how to recover from a hard workout session. And it's really just the basics. It's nutrition, it's hydration, and sleep is also restorative. Contrast showers where you alternate hot and cold water, 30 seconds each, 3 to 5 times, can also help your muscles recover. Stretching lightly, moving easily post-hard workout, and foam rolling are all recommended. Replacing electrolytes lost in sweat can help prevent cramps, so going beyond bananas, which most people are familiar with. Other things that can be helpful to replace sodium and chloride and potassium are orange juice, coconut water, leafy greens such as spinach or kale, sweet potatoes, honey, peanut butter or nuts, chocolate milk, yogurt, tomatoes, olives, beans, and pumpkin seeds. So hopefully that information will be helpful, but the bottom line is if you have a question or a concern regarding your health, please seek out your athletic training staff. Thank you.